Hi, I'm Dr. Castanet of Back Strong Clinic and Atlanta Physical Therapy. I'm making this video to provide some ergonomic advice to people with back or neck pain. So, in no particular order, I'll start with sitting. Sitting is a real problem for a lot of people with back pain, particularly. Sitting is difficult intrinsically and biomechanically because it bends the back when you sit. Most of us kind of know intuitively that when you bend forward like this, it's difficult on the back. And it can be difficult if you either bend too far, or if you stay bent over for too long, or if you do it repetitively too many times in a given time frame. So that's something that you ought to be mindful of when you have back pain. In fact, even when you don't. Just as a precautionary measure for anybody with a spine, it's good to know what are the things that we do in our lives in the way of our activities of daily living that are more and less physically demanding on the spine. Sitting is similarly difficult for the back because while it's clear that this bends this part of your low back, and that's why it's biomechanically difficult, it's not as obvious that when you sit down and bring the hip up like that, it also bends your low back to some degree, and bending the spine or flexing the spine away from what we call this neutral posture where you're straight, which is the posture we assume when we're either standing, walking, or laying down flat. Any deviation from that neutral position is physically demanding on the back. And sitting, when I turn here and bend my hips and legs and sit like this, does bend my low back a little bit. So it is intrinsically demanding. Now you can mitigate the physical demands of sitting if you recline your seat. If you have the freedom to recline the chair and open up the angle and come closer to a supine or prostrate position, it's easier on your low back. I'll demonstrate here for a moment. This chair, of course, provides me the freedom to recline if I want to. So I'll have a seat here and recline this way, and you can see that the further I recline, the closer I come to a straight position or a non-flexed position in my low back, and the easier it is on my back biomechanically. Of course, this isn't practical all the time. There are occasions when, say, you're watching TV, when something like this would be practical if your chair permitted you that freedom of movement. But there are other times when you're working, when you have to work in front of you, where something like this wouldn't be feasible. And there are times when you drive when you couldn't recline the seat, certainly this much. But to the extent possible, when you're working, be mindful that the further upright you are, the more difficult it is biomechanically on your back. So you don't want to stay there for prolonged periods of time without getting up and taking a break, assuming a neutral posture again, and giving your spine the relief from those physical demands. If you're working at your desk, try not to work over your desk. In other words, in an exaggerated flexed position. That's even more physically demanding. Sometimes just being mindful of the subtle difference, but meaningful difference that your chair posture can make a big difference in your back pain. Particularly if you have pain maybe that doesn't bother you on a regular basis, but that bothers you occasionally. Sometimes you can expunge that kind of intermittent, daily, mild back pain by just being more mindful that when possible, you should recline your seat a little bit. Similarly, when you're driving in your car, it can make a big difference if you try to recline your seat somewhat. Sometimes just 10 or 20 degrees like that, extrapolated over weeks, months, years, and a lifetime, can make a huge difference in the way that driving influences your degenerative back problem. And it probably is a good idea to consider your spine as a slowly degenerating entity. There aren't many 80-year-olds whose spine looks like it did when they were 10 years old and 15 years old. So we're slowly wearing out all our musculoskeletal structures with the physical demands, postures, activities in our lives. So try to be mindful of the sitting and interrupt it if you're sitting for prolonged periods of time. Reduce the upright angle whenever possible in your car, at work, at home, wherever you're working. And even when you think you're relaxing on your sofa, be mindful that sitting in a sofa like this at a right angle is tough on your back. And you'd be better off if you could assume a recumbent or semi-recumbent position. You should also feel like wherever you're seated, whether it's work, home, car, that you have good support in your back, so that there's some influence on your back that discourages it from sinking into the chair, which actually flexes it more. You want to feel like there's some kind of support. Some people might even use a towel, a rolled up towel, or a cushion in their low back to reduce some of the bending of the spine that happens when you're seated. So enough about sitting. I want to give you a tip for some physical demands and how to manage those when you're doing things that are physically demanding on your back. One of those things is, of course, getting down to the floor, let's say. If I was going to get to the floor to pick up something, what I would do is I would not just bend my back, but to squat as well. So you want to bend 3 joints, your back, your hips, and your knees, rather than just one joint, your back. That distributes the stress over several joints and makes the given stress on any one of them much less. But something that most people are not told of is that it's a good idea to deliberately hold your breath when you do anything that challenges your back. When you hold your breath, that contracts these muscles around your trunk, the so-called core muscles. And when they contract, they compress the air in your abdominal and pelvic cavities. When you compress that air, it makes for a rigid air cylinder that stabilizes your spine and protects your spine from physical demands. Athletes do this very often intuitively. And if, for example, you watch the athletes that place the greatest demands on their spine, i.e. weightlifters, you can hear them hold their breath when they displace weights vertically. So, for example, you might see a weightlifter squat at the bar, hold it like this, and breathe, and then hold his breath as he lifts the weight up to this point. And then at this point, he'll breathe again, and then he'll hold it as he displaces the weight overhead. So it will be like this. And then when he gets it up here, he can breathe again. But this is a potentially very unstable position. So they typically will breathe very shallowly and not freely in a position like this, because they have to maintain this trunk stability in order to place those kinds of loads on their spine. In any case,